Thursday night. It's 7-ish. It's time for Ask Melissa Anything, where we talk about your life and your body, where we believe your health is your responsibility, where we believe age is just a number, and most importantly, that pain is not normal. I'm your host, Melissa, with Melissa. It's been a week with Nephew Physical Therapy. I'm going to warn you guys, I didn't post this week, but I figured I should come out here anyway in case you're getting used to seeing my face every Thursday night at 7. So hello! Let me just tell you, we're in week 4,757 of COVID-19. Feels like it. And managing life is no joke. I didn't sign up to be my kid's teacher. And praise the Lord, they have amazing teachers who I can reach out to, who are guiding them, who are so supportive, who aren't mad about late assignments, all that stuff. But I didn't sign up for that when I signed up to be a business owner and a wife and a physical therapist and all of those things. And so juggling all of that stuff in the middle of this, I'm like lucky I remembered that it's Thursday. There's been so many blessings, and I hope that you're noticing this in your life, because I know that many of us are very frustrated for a lot of reasons, no matter where you land on the issue about shutting everything down forever to opening everything back up. I am working really hard on finding the blessings. And while this particular season of life is like nothing I had planned, I hope you can relate. The opportunities to help other people in really simple and yet profound ways has been staggering to me. And so tonight, I'm going to talk a little bit about what's going on at Nephew Physical Therapy. I want to tell you about our team, some of the things that are happening behind the scenes. And if you do join us and you want to ask a question, throw it in the chat. I'd be happy to answer. Tonight is really an open mic night. So we're going to ask, you can ask anything that you want. But what I want to talk about tonight is trying to turn challenges into opportunities, which I believe strongly is really how the body works. And I do believe that the body thrives on challenges when we talk about it from a physical therapy, physical perspective. It definitely wants to be challenged. It wants to work harder. It wants to jump higher, run faster, lift more. Our brain, oh my goodness, it's amazing to me when I actually sit down and read, and I've started a new book yesterday, how it wakes my brain up, how I am more energized as a human to learn new things and understand new people. So it's pretty amazing when you start to think about the opportunities that can happen in such a challenging time like this. And the most tangible and most measurable way is the stuff that is happening day to day in the clinic. And we continue to slowly open a little bit more and a little bit more and a little bit more. And we have people reaching out and we're helping people. When I talk about this challenging time and things that are happening, we are seeing people who, how would I describe it, are noticing that they hurt. It's probably the best way to describe that. And so we're noticing that people are hurting and they're paying attention to it. Tori, hello. Looks like Tori is one of those people. Yes. Okay. So Tori is a dance instructor and she's doing it at home on the cement floor. She's struggling. Yes, Tori, that's what I'm talking about tonight. I'm noticing people who have headaches and neck pain, probably because they're working at home, not at their great desk that they had at work, or they have less to do, and so they're slowing down like, wait a minute, I've been in back pain for decades. And so Tori, who's now teaching dance from home on a cement floor, she's noticing those things too. And she's young. I'm telling you, Tori, you're young, right? So a couple things, right? Like obviously I'm going to guess you can't wear tennis shoes, right? Because you're teaching dance. So a couple things. Part of it is just the season, right? Part of it is just acknowledging that it's not normal. I mean, the most simplest things would be, can you put down a rubber mat? Can you add something soft? But I imagine, as I am not a dancer, that those things aren't necessarily feasible to do the things that you need to do. So what we need to do then is, how do we do other things that support the body better? So when you say your veteran body is struggling, I would be curious to what areas you're struggling with. Because traditionally, if you were to say that it's, say, your back, right, or your hips or your knees, your lower body that's not liking being on that cement floor because it's used to being on a much better professional dance floor, what it's probably telling you is it doesn't like all that weight bearing, all that pressure. And so my suggestion to you is probably to spend more time on strengthening that hip, pelvis, glute region, which I know, I'm a broken record. I'll probably say that 47 times on every single call. It's all about the glutes. However, when you're standing and you're not getting good support from the ground, unless you can go outside and do it on the earth, which is, you know, a much softer structure, you're going to have to accept that that's the trade-off at this time. So what is the question I would ask then is, what is happening while you're teaching dance? And what it is you're moving on a much harder surface, so your body doesn't respond to that force as well. So how do we then take better care of your body? So that's where we're talking about simple things like bridging, clams, doing hamstrings and exercises on a ball where you're doing lifts, just engaging those kind of hips, those legs, getting them all firing and working together. I would say those would be some of the things I can address if you can't change your environment. Obviously, we can tie what's happening to your environment. If you can change it, do that. But you're pretty smart, so I'm sure that's kind of a tough thing to do. So those simple things might be stuff I would start out with. Of course, like what I was mentioning, is we're having people reach out because they're having pain right now because of their changing situations and circumstances. And the challenge is we don't know how long in some different areas of the economy when some things are going back. And our bodies aren't used to it, right? They're just plain not used to what we're putting them through right now. In the first couple weeks, I went from seeing 0 patients the previous month to seeing like 80, which is a big jump. And I was exhausted and tired. And I'm like, oh, my tennis elbow might come back. Oh, is my neck hurt? You know, those different things. What's happening? So I'm going to make the assumption, Tori, that you need to be working on your hips and your butt, because everybody should. We've been talking about tummy time here over the last few weeks. Spend some time on your belly and put some weight on your shoulders, kind of like a semi-plank. So you're building up those extensor muscles. Anything you can do to get stronger is probably going to be to your benefit. So that in general is probably my advice. But if it keeps bugging you, you know where we are. We'd be happy to help. And that's kind of what I was talking about before Tori jumped in with her question, which, thanks, Tori, for asking, is I got to see somebody who has a long history of back pain. Not months, right? Years. And not, I mean, not old. My age, right? And with that, it's amazing what we have come to accept as normal. It's why when we say because pain is not normal, it's because it shouldn't be considered normal, because that's no way to live. Who wants to live and be miserable? I don't. Thank you very much. So what can I do to prevent that? So fascinating, where again, very active people. If I think about the people that we are seeing right now, these are very active individuals. So if you're an active person who thinks, why do I need therapy? It's not going to help me. It's because we are going to dive into those details in a way that you probably haven't heard before. And I don't say that because I'm arrogant. I'm just saying that based on experience. What we're going to do is we're going to we know you're strong, right? You're doing exercise classes. You're a runner. You're a swimmer. You're a rugby player. I'm trying to think who we're all seeing right now. We've got all these amazing active people, volleyball players, and then professionally active, all that kind of stuff. Sorry, I have the COVID itch. Just kidding. I just had the itch. And my friend the other day on her video was like, is it illegal to touch her nose? Anyway, I digress. Focus, Melissa. Very active people, and whether or not they're less active, right, because they don't have access to the things that they were doing before to keep them active, or like I was saying earlier, that they have paused now to say, wait a minute, my back hurts, and it's hurt for a long time, and somebody over right here has had back surgery, or they've had this, I don't want that to happen to me, and they're doing something about it. It's my favorite because we are proactively addressing that. And when I say we dig into those details, we really need to find out what's weak. Let me tell you this revelation that happens a lot when people come to therapy is my right hip hurts. Okay, I say this without being insensitive to people who have had strokes, but that is usually a neurological condition. That is usually stroke, paralysis, those kind of things. If you've known somebody who has suffered from something like that, that is one-sided weakness, and it's very obvious. However, when we're talking about muscle and joint aches and pains, the location of the symptom, right hip does not mean the right hip pain does not mean the right hip is weak. Could mean that there are some muscles in the left hip are weak. And it happened a couple of times this week, at least 2, maybe 3, and it's really fun. So I'm testing, I'm going, okay, you're weak here, and they're like, their face says, wait, what? My pain's on the other side. I can see it, right? I've seen this face so many times. They go, and then I check the other side, and it's the opposite muscle that's weak. And then they're really confused. And it's so fun. Not because they're confused, because it's an opportunity. Remember, we're talking about opportunities, not challenges, or where challenges become opportunities, is that I get to explain more about how the human body works and how it really does work together. I used the analogy today. Have I told you guys yet about the circus tent? Okay, so I graduated in a circus tent. That's what, and every single picture in our circus tent was red. You looked red because it was red and blue, because the high school I graduated from did not have a big auditorium enough to have all the graduates and their families and everything else. And I'm gonna yawn. So we did it with a big giant circus tent outside. Okay, so when I think about these big giant circus tents, first of all, I think about graduation. Secondly, I think about what it takes to make sure that those 3 posts, let's say a 3 post in the middle, are upright and vertical. It takes every rope and stake that is all the way around the edge of that tent, it takes them all to have equal tension, symmetrical tension, symmetrical length, right? They all have to be good, because if one side pulls too hard, the whole thing will tip over. Or if one is too loose, right? If one of those ropes on one side, it's not the same side, the opposite side, right? It will be changed, right? It's those opposite corners. We know that with a circus tent. Well, let me tell you, when it comes to your hips and pelvis, okay? When we look at that circle and all of those muscles that are there, when one side, one muscle, okay, because again, think a dozen plus muscles, including the pelvic floor. Let's not forget those key muscles, because we've been talking about those. The pelvic floor, including all the glutes, the obturators. We're talking 15 to 20 muscles, okay? They're not all going to be weak, and they're not all going to be weak or strong on the same side. It's why our body rotates or twists or gets slightly askew rather than just being cattywampus, okay? Just tipping sideways, right? It gets rotated. And so to see, right? Envision that circus tent when you're thinking about your pelvis. Thanks, Amber, by the way. I live in the real world, let's be honest. And if I talk too much PTEs to get too technical, I kind of drive myself crazy. But anyway, that circus tent, we think about all that relationship. That's why I believe it is my job as a therapist to dig into, especially, again, you high-level people that exercise and run and do triathlons and rugby, swimming, volleyball. I don't care what it is, right? I'm just naming a few of the things that some of our clients are doing right now. We need to figure out, we need to dig down deep, which is why the hard part is when you are a patient, the exercise may seem boring. But I dare to bet it will be much harder than anything that you are currently doing, because we're going to get down to the nitty gritty and wake that muscle up and make sure that it's doing its job. Because when everybody does their job, when a team comes together, you win the freaking Super Bowl. Isn't that how it works, right? I mean, don't get me wrong, Tom Brady is a great quarterback, but he cannot win the Super Bowl on his own. It takes a team. It takes offense and defense. It takes muscles on both sides of the hips and pelvis. It takes the whole thing working together. And that's my job, is to figure out why, teach you how to do it specifically, which is also why, oh, you guys, I struggle so much sometimes here trying to teach exercises, because I can't reach through the camera and touch you and go, wait, move this. No, do you feel it here? No, do you feel it? Because that feedback, it's kind of what you're paying for. You're paying for that coaching, which goes into, we'll head down another rabbit trail here tonight, is when you are choosing a place to go for physical therapy. I'm going to talk about this right now because this is really important. The reason I am less afraid during COVID-19 is because we have always treated our patients one-on-one, meaning one patient to one therapist. Why is that important in this particular world? Well, because people are afraid of cross-contamination, right? Now, I'm not licking things and all that stuff, but because we wash our hands good, right? Everything's on the skin, right? Wash our hands again, wipe down surfaces. We're good, right? We're good. But if I had to treat you and you and you, that would be an issue. But I have a greater issue with that than germ passing. And here's what it is. If you are going to physical therapy and your therapist, oh, I'm going to make somebody mad, I know, but this is what I got to say. If you're going to therapy and the answer is go over there and do that exercise and let me know when you're done, I want to bang my head against the wall. How is that making sure that you are doing your exercise correctly? Because quality over quantity every day for me when I am trying to correct for weakness, for pain, for dysfunction. Now, yes, may I throw you on the bike for 5 minutes because you had knee replacement? Yes. Am I throwing you on a bike for 5 minutes because you have shoulder pain? No, probably not, okay? I gotta have a reason why. And I will tell you, if you don't know why you're, all these rabbit holes I'm gonna go down. If you don't know why you're doing an exercise, your therapist needs to tell you. You need to understand why. Because here's the thing, folks. If you don't know why you're doing that exercise at home, to follow up to the very high attention to doing the exercises right, plus that manual therapy, if you don't know why you're doing it, you won't do it. I mean, if I just said, hey, Tori with her question, hey, just go on the floor and do some bridges, but I don't tell her why. Doesn't matter. Then you're not listening to me. Right? Isn't the whole point? Oh, the whole point is to get buy-in so that you critically think about how to better take care of your body. When we talk about your life and your body, I am saying to you that you need to take care of yourself. You need to understand how your body works. It is your health, your responsibility. So if I'm going to ask you to do something, you better understand why. And if I don't, I'm not doing my job. So what I'm saying is, when we choose a medical provider, these are the things we don't know how to ask. When I'm going to decide to choose, I'm going to say I have a new specialist of some kind. How do I ask the front desk, So are they going to tell me why I'm doing that exercise? Is that the question we can ask? Are they going to just see just me? How many people am I going to see when I go there? Are they going to share me? Are they going to pay attention to me? Do they do hands-on therapy? Or do they watch me do my exercises? Or do I just come in and go from one machine to one machine to one machine to one machine, and then I'm done? Do they just use modalities? Okay, we all think they're fancy and great. And once in a while, using ultrasound or using e-stim is a tool we pull out when we've got a lot of pain. But you've got to know why. And I don't use it that much, because I would much rather spend my time working on those things that are sore and teaching you what you need to do to take care of yourself, which is strengthen this, stretch just the right side. Oh, there's something different, right? Sometimes when you're trying to level everything out, you don't stretch both hips. There's something to think about, which again should come with a question, why? It's my job then to make sure that if that pain comes back after you're done with therapy, these are things you can try, because I want you to fix yourself, okay? When we have models that require dependency instead of independence, again, we should be asking ourselves questions of why, right? Isn't the point your health, your body, your responsibility? I would say yes. So that is where I want to encourage people to be very discerning when they choose a medical provider of any kind, all right? Of any kind. It needs to be somebody that you trust. It needs to be somebody you kind of like, but it probably also needs to be somebody that kicks your butt. So hilarious today when I'm walking through the gym and one of Naomi's clients says she's kicking my leap today. I was like, oh, she's doing a good job, right? And then this is, I will tell you, this is a very young, very healthy individual who plays very competitive sports. And she is kicking his bleep, his booty, which she's not doing it just to make him suffer, okay? She's doing it to target the things that are weak. And that is where people who are very strong and very fit and very strong, fit, have endurance, all the things, when they have all that stuff, it is our job to, again, dive into those details. So, yeah, so that was just one of those highlights today. So, again, if you're joining us, we're doing open line tonight. Got a great question from Tori, who's a dancer, whose environment changed because she's teaching from home on cement floors. So, Tori, again, thanks for that question. Oh, Megan has a question. Megan, I don't know if I can address it or not. Put it in the chat. So again, we're talking about a lot about the fact that what we're living through right now is just really, really different. And how we're managing through that. Rebecca, yes, Naomi kicked your booty this week too. But note, friends, if you read her comment, it says, I'm wicked sore glutes and hamstrings. Yes, she's from Boston. I mean, she said wicked. What else does that mean, right? However, sore in your glutes and hamstrings is almost always a win. Almost always. Once in a while, if that pain is neurological or, coming from a nerve or something like that, right? That's not okay. But muscle soreness, absolutely that's okay. I was just touching the screen. Sorry, I'm messing up there. Because I'm like, am I missing Megan's follow-up question? Yes, Rebecca's laughing because she's from Boston. That's right. I can hear you saying it. I can hear that wicked coming. I can't do it. I want to be able to say wicked like I'm from Boston because it's freaking awesome. So great. All right. Well, Megan, if you put your comment in the chat, like again, I'm trying my best here, running on my fancy phone. So, okay. Ooh, she's going to talk about her hips. I kind of like this. All right. I noticed the last few days my right hip kind of hurts when I walk. It seems like if I'm walking weird and causing it. I guess what I'm wondering is, there a daily stretch I can do to help? Well, I'm going to tell you to strengthen your butt, first of all, because that's Melissa's #1 answer to everything, and I'm a broken record. So if the right hip hurts, So since you asked about a stretch, there is actually one stretch that I do recommend over and over again, and that would be a hip flexor stretch. So the hip flexor stretch is actually very hard to do, but we stretch out the hip flexor so we can strengthen the butt. That's why. So the hip flexor is on the front. It is the muscle that makes you, when you're walking forward, it lifts your knee up off the ground. Okay, so if you're sitting in a chair and you lift your knee up, that causes you to use your hip flexor. So it's on the front. It is also a muscle that gets really tight when we sit. Okay, and I'm going to make an assumption here, Megan, but you said right hip. Most situations, again, this is based on my 20 plus years of doing this, is seeing that the right hip flexor is tighter than the left. If you guys want to get into the why of it, there's some theories, but just based on my clinical experience, that right hip flexor is tighter than the left. And then what you see, ooh, this is also fascinating, is then that right butt cheek is weaker than the left. Okay? Think about that circus tent I just was talking about, right? Where one thing is tight, makes something else weak. Opposites, right? Right? One does too much, the other one kind of gives up. So, hip flexor stretching is tough because people want to turn it into a big giant lunge. So, this is always what's fun. My studio tonight, right, is the headboard of the bed. So let's see here, Megan. All right. Good, Megan. I'm glad you're following what I'm talking about. Okay, here's what we're going to say. All right, I think I got this. I can't do it. This is going to be quite hilarious because this is one of my studio issues. All right, let's try here. Okay, so hip flexor stretch. You're going to go in a half kneeling position, okay? I'm doing this opposite, but you're going to do this on the right side, So I'm half kneeling, okay? Now, of course, I'm wearing jeans, which is not the easiest way, and because of the COVID-19, you know, you heard that maybe it's not 19 pounds, but it certainly does feel like it in my jeans. So many lifestyle changes. Anyway, stay on track, Melissa. I know, I'm a squirrel chaser. Okay, so what we're doing is we're half kneeling, and the side that we're stretching is the knee that is on the floor. And then what we're going to do is we're going to be nice and upright. And actually what I'm going to do here, okay, if you can see, is I'm going to slightly push that hip forward, okay? And actually, it feels really good. So what it is it's right here, okay? It's right where kind of that thigh comes right into your belly, right there. Now, I'm not lunging way forward, okay? All I'm doing is slightly pushing forward. See that small motion? Just forward, okay? So I'm just coming forward there. Now, again, rotation, we were talking about rotation being an issue, so you might turn side to side. But as much as you can, square up your hips and let that hip come forward. Not a big movement, so you gotta squeeze that butt cheek and tuck and tilt forward. So you've got to be able to do the pelvic tilt, okay? That's where you can just roll that pelvis, okay? Where you're laying flat on your back often. Laying on your back with your knees bent, feet on the floor. So you'll be able to do that pelvic tilt motion, which is where you engage your glutes, relax your belly, roll that backwards. So you're gonna do that pelvic tilt in a half kneeling position. Whenever we go vertical or we get upright, we're gonna have a harder time controlling our pelvis. So, which means we're gonna have more things that can cheat and compensate, which is fine. We just have to be aware of it. And so what we need to do when we're stretching that, that psoas, P-S-O-A-S, when we stretch the psoas, we got to really make sure we isolate that to the front of the hip and the front of that kind of abdominal area. Because that muscle, by the way, attaches to your inner groin, so think about that, dives down behind your guts and organs and attaches to your back, L1 to L4, okay? So that's right around your waist, a little bit around the areas above and below your waist. So that muscle dives down and attaches to your back, all right? So when we talk about a tight back, it is definitely due to the fact that that psoas is so tight and it's tipping everything forward, which causes you to substitute your back for your butt. Did you catch that? Really important right there is that when our pelvis tilts forward or we walk around like we're pregnant all the time, or we are pregnant, or we store all our extra body fat in our belly and it tips us forward. When we shift all our center of gravity forward, it then makes the butt go away and makes the back really tight. Okay, good, Megan. I'm glad that makes sense. So try that. You can try to stretch both sides, but what you might actually find is that that right hip is actually tighter than the left. And that's, again, from a clinical perspective, something that I normally see. So great question. And also a muscle that a lot of us should be stretching, especially if we sit too much. Or Megan, lay on your tummy. You need some tummy time. Also open you up. So when you're reading a book, if you got time to read, I know you're raising a little one right now, lay on your tummy and just read a book. That will also open some things up. Hi, Brenda. All right. Yes, I'm sorry. Back to Megan. Yes, you've been pregnant all the time. I know. All right. So Brenda's having some challenge. Oh, a friend with sciatica. Any advice I can give her? Okay. So here's what I will say. Sciatica has become a general diagnosis for nerve compression. Okay. Which basically anything that causes numbness and tingling down our legs, people will call sciatica, which is not necessarily true, okay? So the sciatic nerve is a big nerve that runs through our butt cheek, okay? And it goes around some muscles and stuff through there. So it starts actually there and runs down. When people are having nerve pain from their back all the way down and around, okay? And it travels. So there are different patterns that nerves travel down your legs, all right? And when you tell us that it is all the way down to your big toe or down to your little toe or to your inner knee or your outer knee, that pattern actually, there is a map. We have maps of the human body that tell us which nerve, which is going to be L1, L2, L3, L4, in the back is getting ticked off. Because remember, don't forget, the nerves are the first to get mad at you and the last to forgive you. And so when that nerve gets ticked off in the back, it sends it down the leg. So the challenge, Brenda, is this. Is it actually a sciatic issue? This is, and again, we're talking about critical thinking through all of this stuff. So while I may actually try to answer the question, I often pose more questions than I actually provide. Sorry, I'm just adjusting my camera here. It's tipping and it's about to fall, right? So just a second. Sorry, technical difficulties. Again, my fancy studio here. I like to make myself laugh. So, oh, sorry, I'm about to lose it. Goodness gracious, Melissa, just talk. There we go. All right, we're back online. Okay, so we're talking about sciatica. So the question, Brenda, is it sciatica? Oh, and she's 91. Oh, she probably has a weak butt. I know, I have no answers. So 91 years old does change the equation some. Because if you had told me it was a 40 or a 50 or even a 60-year-old, I would probably ask more questions like, can they lay on their stomach? Can they squeeze their butt cheeks? Those kind of things. And so what's causing it, maybe in a 91-year-old, is not as important as trying to do some things to decrease their pain level, all right? And so that's where getting those glutes to fire, of course. But in a 91-year-old, again, depending on their level of mobility, may look like sitting in a chair and just tightening their butt cheeks. Oh, Brenda, I know. I feel helpless when people are in pain and I can't actually touch and help them. It's really a thing, Brenda. I know somebody who is in a lot of back pain as well and went somewhere for therapy, and I don't know that it helped, and I guess it cost a lot of money. It wasn't my office, and now they don't feel like they can afford to go, and I'm asking myself, should I just do it? Like, it's hard, right? It's so hard. And she's tiny. Yes, right? Like I can envision this sweet 91-year-old lady in pain. I would encourage her to try to squeeze her butt cheeks in sitting, okay? So one of the funny visuals is if, you know, if she had to squeeze a quarter between her cheeks. And you can do that in sitting, right? You can make them as tight as you can and relax, right? Where she tightens and holds it and relax. So that she's going to need as many muscles to help her, because often, again, as we age, we do sit too much often, and then therefore we stop using those muscles that support us. The other thing, right, depending on her level of pain, she needs to be moving. She really does, and she doesn't want to. And again, I'm making some big assumptions here. And the disclaimer, as in every single Ask Melissa Anything, is this is given without an evaluation, a hands-on exam, any of those kind of things. If she was in my community, I would want her to come in, because I would want to rub her back and maybe rub her glutes. And I'd want to have her do just some simple exercises and build up some strength and see if we can get her standing straighter. Oh, it's so hard. It's so hard, Brenda, when we see people suffering. Oh, and she makes herself walk around the block every day, which is amazing, and I love that. So, yes. Yeah, instead of the quarter, you squeeze the $100 bill. You're right, Becca. The other thing, Brenda, is she's walking around. Can she go to a therapist? If she can find a good physical therapy clinic that does hands-on therapy, and that is really sweet to old ladies. I'm like, I want her to come in and see, like, our team. I want to help her. I want Hannah to help her, or any of those kind of things. Oh, because she probably needs some strengthening and she needs some massage. But if she's crying the whole time, that's not good either, right? Her body is telling her. Her body is telling her that she, I don't know. Yes, and you've just, right. The doctor will only see her on FaceTime or Zoom. Well, tell that doctor to write a doctor's referral for physical therapy and find a physical therapy place that's open. Because I, as a physical therapist, would not need her to be evaluated in person by a physician. I wouldn't need that to know what to do for my job. I would do the evaluation. I would figure those things out. That's what, yes. Yeah. And just say, she just needs to say, I need a physical therapy referral. Yes. Try that. But maybe help her find a place that will do some manual therapy, massage, that kind of stuff, and will help her to get stronger. But she sounds like she really needs some hands-on love and care too. So I actually might know some friends in DC, Brenda. Let me, she's in the DC area. I actually have a friend who's a therapist out there. I'll reach out to you, Brenda, and I'll see if she has any recommendations. So send me a private message, and then we'll connect. Maybe I know some friends out there. I want to go back to Phil's question. I think I saw that there. Anything to address mild scoliosis tends to show up as one side of the hips or pelvis slightly higher than the other. Okay, so first of all, technically, and I only know this because my son was diagnosed with scoliosis, scoliosis technically isn't scoliosis unless it's 20 degrees of curve. I did not know that. I did not know that there is this criteria. Actually, nope, I take that back. Wrong, 10 degrees. I'm such a liar. Sorry, Cooper's been doing so much better. At 20 degrees, you can get braced. That's the criteria. At less than 10 degrees, it's not even called scoliosis anymore. That's what it is. What is true, though, to your point, Phil, and I think you are spot on, is many people are curved or crooked, okay? So again, critical thinking questions tonight. Is that curve caused by the pelvis being rotated, or is it being caused by the back curving? Okay, so there's a couple of different factors in that situation. And so what we look for is how is that showing up? So you want to share symptoms. Are there symptoms or pain? Because what part of your body, that would be the follow-up question, is what part of the body is paying for it? Oh. Phil says he never knew there was any curvature until he was 37. Not sure if it was always that way or developed later. So here's what I would say. I have seen, we'll go back to sweet little old ladies who sit in chairs too much, who get their backs really curved. They did not look like that, right? Think about that, Phil. Don't you know some grandma or sweet little old lady who's bent over and curved and all those kind of things? She wasn't always like that, right? She wasn't. And you're active and you're moving and all those kind of things. So whether the curve is significant or not, right, like I said, it's not abnormal. It is not abnormal for us to be a little bit crooked. So when we see the spine curving, we have to ask a few different questions. Is it muscle related? Is it truly a bony structure change? Or is there something else going on? Again, I can speak to Cooper, who had a very significant, when he was 4 years old, he had an almost 30-degree curve, 28 degrees. What that means is over 30 degrees, they start fusing your spine because it can collapse your organs. He was 4. What we found out along the way, though, was that his curvature actually happened because of something that was happening in his skull growth and his brain growth and the fluid in his spinal cord, okay? And so that actually was the cause of that. So I just have learned that that cause of scoliosis can be neurological, it can be musculoskeletal. And so when we see those things, we need to dive into it, right? Because scoliosis, that severe in a 4-year-old, kind of strange, okay? So what we're talking about Phil having some curvature, stiffness, and a hard time with twisting motions. So what I would guess, again, without having you here to move you and twist you, those kind of things, I would guess that it's more difficult to either rotate to one side versus the other or bend sideways one or the other. So what we see in that situation is the body has already set itself up. It's already a little bit, and so when you try to go to the right, it doesn't go as far, and it goes farther to the left. Now the question then again is, we go back to the hips and pelvis to ask ourselves, is it because the foundation, is it the basement is a little bit crooked? Okay. Yes. Good, Phil. All right. So I'm guessing correctly, right? You're like, and it's consistent. It's almost always more difficult to turn to the right than the left, those kind of things. So what we want to talk about then is we would evaluate, we would check for, okay, what's happening? Is it the hips or is it the spine? All right. And so when we think about a house, we think about it having a solid foundation. And then we have the main level, and then we have the roof. Okay. So if you buy a house that's fallen apart, nobody fixes the roof first, right? You're not fixing that roof if the whole thing's leaning. Okay. You're going to start with the basement. Okay. It's also why people don't buy houses. If they have foundation issues or cracks in the basement, it freaks people out. Unless you are really good at fixing foundations and can lift houses and do all that great stuff, then you're not afraid of it. But we know, especially in Michigan, because we have basements, is we want those basements to be solid. When we bought our house, the fact that the basement was finished and had poured walls that you could see, you could see the 2x4s, you could see the floor joists, you could see all that stuff, and you're like, okay. I mean, big metal beams across the basement. Okay, this has a sturdy foundation, good bones. Know that when it comes to buying a house, we want to make sure that it has a firm foundation. Then, after we fix the foundation, we move upwards. So sometimes when we're talking about scoliosis, again, it depends on where it shows up too, if it's in the low back or in the upper back. And sometimes we have to start at the basement, make sure that that's working, and work our way up. Sometimes what we see then is it shows up more on the shoulder blades, okay, where people are a little bit more tilted up there. Then you're working on, we'll just say, the second floor, second foundation, which is the shoulder girdle region with the shoulder blades, the shoulder, the neck sits on that, all those things. And you need that, again, to be strong and stable. And what we see as far as not being stable there is shoulder blade winging, Okay, when people's shoulder blades come off their back, it's not because they're skinny, it's because they don't have enough muscle to hold it flat. Okay, keep that in mind. All right, they should roll on your rib cage. And so sometimes there, we then again build up muscle through that secondary foundation to make sure that that's all firing and working well. So Phil, to go, you'd want to go back again, and we would have, from a therapy perspective, again, because I'm a therapist and you're asking me, I would really be looking at not just those glutes from going backwards, but I'd be really looking at the sideways motion and that rotational motion. Okay, I'd make sure that that's all good. I would be checking for alignment. All right, meaning I would be double checking: is it truly rotated? Is one leg longer than the other? I don't think God makes that many mistakes. I mean, I know we all think one leg is longer than the other, but I guess I question that again to know, is that actually that one leg is longer than the other? Or is it the fact that things are a little bit crooked and cattywampus? So that's, that's something to think about. But I would say if it's truly like a curvature of the bones or whatever, you're not going to be able to force that to go the other direction if the basement's crooked. Okay? So had that same discussion with a client today, not equal side to side, and it's not something that I believe she could. Leg length he measured even once. Okay, trying to follow. Length. Leg length he measured even. Okay, it's even. Great. So, good, right? And there's a lot of, again, that stuff can get skewed. So then we would look at what's going on in the hips and pelvis. And like I was saying, I evaluated somebody today who couldn't bend well or to one side versus the other. The misconception is that I can just stretch to gain that motion. But if you're running into a bony or a hard end feel, you're going to be stopped by the joints. So how do we get the joints out of the way? Well, you're asking a physical therapist, okay? I'm not going to manipulate it to force it to go in one direction. What I'm going to do is I'm going to, again, ask the question going back to earlier this hour where we talked about the tent relationship. We're going to talk about symmetry. We're going to talk about what's tight and what's weak. And we're going to dig into those things because forcing something to change is not, this is in life, right? When we force something to change versus change it over time, those changes over time last longer. Think about weight loss. Quick weight loss is hard to maintain because we often didn't do it with the habit change. I can own up to that. A couple years ago, crazy food, allergies, all the things, dropped tons of weight, didn't change my habits. So I'm right back where I was because my habits are still the same. But people who are successful at making long-term change are doing it the hard way, okay? So I kind of actually think physical therapy is the hard way when it comes to making changes at stuff because we're trying to take two steps forward, one step back, 2 steps forward, 1 step back. We're okay, do this exercise, work on this. Next time you come in, we'll loosen up those glutes, we'll stretch that psoas, we'll do this. Okay, you work on it some more, all right? And we work on it over a period of time because building strength takes 4 to 6 weeks. It takes time. The body, can break pretty quickly depending on, what's happened to it. Again, based on trauma, based on, force, acceleration, mass, all that stuff. But to heal it over time, there are certain limitations to what the body can do. And so that is where, when we're looking at that, if the leg length is the same, then great, right? We're not looking at lifts and shoes. We're not doing any of that kind of stuff. Because we really want to, as many times as possible, have an internal fix to an internal problem, not an external fix to an internal problem. I'll say that again. We want an internal fix to an internal problem, not an external fix like a brace or a lift or a band or a support or a whatever to the internal problem. That's why everybody's like, is there some tool? Yeah, they sell those bands or whatever, you can hold yourself up. Great, in theory, but that only works if you build strength, okay? And if you take it off, does it go back? Do you just fall back into horrible posture, or have you built that strength up? So that's kind of those things that we consider when we're thinking scoliosis. And the back curving isn't an issue unless we actually see it show up functionally in limitations. And again, that body has to work all together. So makes me think of the sweet young preteen girl who kept getting treatment for her shoulder. And we were probably the second or I think she had done therapy before and then had a personal trainer. It was her shoulder. Well, something in the way she walked made me think, let's take why don't we put a gown, okay? So this is the hard thing. The other thing, all you crazy Americans, is we do a much better job the more we can see, right? Like I remember one of my instructors way back in the day going, if we could just get all our patients naked, be a lot easier to see what's going on. And because when I can look at your skin, right, and appropriately clothed and all the rest, your body tells me a story. I might see a scar. Oh, did you have knee replacement? Because you forgot to tell me. Oh, did you have your appendix out? Did you have a C-section scar? All those kind of things. And when I got this young girl into a gown, it was right there. Her back was like, whoa. She, because of all of her activities, was overusing her shoulder, and all people saw was shoulder pain. I had to fight, and took a while because, well, I won't head down that path of frustrations that happen in healthcare. But eventually this girl did get to a pediatric orthopedist, did get to back bracing, did do all of those things, because when we're young and still developing, and if it truly is scoliosis, which is why seeing her gave me that whole picture. And it was important that I made sure to see the whole picture. She hurt in the shoulder, yes. Did she need to be stronger? Yes. But was the rest of her body working correctly? No. Did I still work with her? Yes. Because she still needed to have her alignment done. She still needed all of those things. But we needed to get a specialist involved. And I remember that first day picking up the phone, like, she needs an x-ray. There are reasons to do x-rays. So really, really important to work together with our other healthcare providers and finally get her to where she needed to be. All right, Tracy, question. All of a sudden, really, all of a sudden, my left hip has started to hurt, and now it hurts when I try to climb a ladder at work. And watch out, I'm back on them. Okay. All right. So left hip hurting when you go up a ladder. Okay. So let's see. My first question, right? Because again, every question you guys ask me comes back with about 3 or 4 other questions. And basically all I'm doing is just sharing with you my thought process and how I'm getting there. So my first question is, what is your definition of hip? That's funny, right? It's funny because people, the hip socket, which is really not as big of an area as people think. So when you say hip, do you mean groin? Do you mean the outside of the hip, right? The outside of your jeans? Do you mean more around the back towards your butt? Because all those different things vary. Now, if you're saying left hip, when you go up the ladder, left hip hurts. Okay, I'm going to make an assumption there again, because just fill in the blanks unless you give me more in the chat. It very well could be that hip flexor, which I'm not demonstrating it again. You're going to have to go back when I showed Megan. Oh. And look at this. We're right back to the first question that Tori asked. I've started to stand more on cement at work than working on the carpet and outside. Okay, so a couple things here, which ties into what we already talked about. So sorry, you might have to watch the whole video again on replay, Tracy. Part of it is hip flexor stretching, okay? Part of it is opening up that front of that hip. Part of it is, like our advice to our sweet 90-year-old, 91-year-old lady, is squeeze those glutes, okay? Engage them. However, that change, which is kind of what we've been talking about as we've been going through this quarantine, shelter in place, people's lives being flipped upside down, all of that kind of stuff, standing on cement, your body is not used to it. Okay? And at the beginning of our call, Tori asked a question because she is a dance instructor teaching from home on cement instead of in her beautiful dance studio floors, right? So, in your situation, my first advice is actually, when was the last time you bought shoes? Most people's tennis shoes that look pretty, if they've had them more than 3 to 6 months, they're done. Okay? And it's very hard because your shoes quality is not based on how dirty or scuffed up they got, like in my kids' situations where they just trash them because, well, they're playing hard and that's the whole point of shoes and getting them good shoes. But I can tell that my shoes are going bad because my shins start to hurt long before they actually fall apart. Okay? Oh, good. You got new shoes. Check. Did you get good shoes? That's the other thing, right? Because, of course, the most expensive thing I buy is tennis shoes these days because it makes me feel better. Okay, so better shoes. Good. All right? So keep up wearing good shoes. Very important. Hip flexor stretching. Okay, so if you're noticing it go up the ladder, it could, again, be what we talked about before where those hips are rolling forward. You're tight in that hip flexor, so you need to stretch it out. Okay, you need to open it up, and you got to squeeze those glutes. So some bridging, all right? That's where you lay on your back, and you're down on the floor, and you lift. I can't even do that with my hands. You're lifting your buns up off the floor, and you're squeezing those cheeks, and you're just holding against gravity. Very, very simple. Do those kind of things. It opens up the front of your hip. Engage those glutes. All right? Here's the other thing I haven't mentioned yet this evening. And this is when we have a tendency to stand a lot, get stuck on cement floors, often indicates that we're in a more labor-intensive job, okay? And what happens is we're tired just based on the course of what we do during the day. And when we get home at night, we don't do as much. Hip flexor. Good. Do that hip flexor. Stretch. But the other thing that I was kind of alluding to is when we have an active job and we're physically active all day, we go home and we're tired, and we probably, hello, like if I'm pointing at you, I've got 3 fingers pointed back at me at least, okay? We should be going home and moving, okay? And that's, whether that's an exercise tape, going for a walk, treadmill, bike, weights, I don't care what it is, intentionally exercising. Oh, I can't even believe I'm saying this. Like, I am such a hypocrite right now. So no, I am talking to myself, and I'm just being honest here. 20 to 30 minutes every day of intentional moving on top of whatever we do during the course of the day pays huge dividends for our aches and pains. And when I start to hurt, my back hurts, or my plantar fasciitis, or whatever, like all the things start to ache. I'm like, oh, and I start to do some squats, or I start to do planks, or I do extensions, or I do all these different things. I'm like, works. Totally works. And not to forget the fact that my attitude gets extremely better and way more optimistic, especially if I can listen to an audiobook by myself on my dead-end dirt road in the sunshine. Okay, it does a lot for my soul on top of my, my body. So in general, the theme of the night is, whoops, text came through. The theme of the night very much is interesting how many hip back questions we have. And that's because it's one of the most common aches and pains in America. We sit a lot. We sit a lot. Spend time on your tummy. Do some bridging. Go for a walk. Walk uphill. Do some stairs if you can tolerate it without hurting things. But as always, and I started this call saying how excited I am by the opportunity for the people that we get to help right now. If you're struggling, I want to give you tips here every Thursday night on what you can do to take better care of yourself. But if you really are stuck, right, and you just can't quite get out of that funk, that hole, that pain by yourself, that's what we're here for. To listen, to give you hope, to evaluate you thoroughly, okay, and to help you move the way you want to do what you want to do, okay? So, like I said, challenges create opportunities, and this time has continued to teach me that through highs and lows, homeschooling, to running a business, to treating patients, to connecting with people that I care about virtually. And so I want to challenge and continue to encourage all of you that while you're facing some challenges during this time, there is so many opportunities for you to come out on the other side of this in whatever capacity, learning something more about yourself, understanding something better, and being different. And I will end this call on the last question from Brendan that says, what's my favorite aspect of being a PT? I'm going to say it's a tie, okay? Because I don't know that I can really do one without the other. I think, Brendan, my favorite thing is the problem solving, okay? You hurt, let's figure out why, okay? One of those big things. Secondly, it's the relationships. It's the fact that a lot of these names that I see and faces that pop up, I've had the privilege to get to know over the last how many years. It's the fact that I get to cheer and celebrate when people feel better. It's the relationship. And so because I love to figure out what's going wrong with people, I get to give them hope. I get to build those relationships. So Brendan, excellent question. I appreciate it. And we'll end on that note. So again, friends, pain is not normal, and Nephew Physical Therapy is here to help.